we use a Medtronic computer system to do the navigation system to do all of our sinus surgery. So the system makes the procedure more accurate, less painful, lowers risk, complications. So right now what Ruben's doing, he's registering the patient. The patient already had a CT scan, all information stored in the computer. But what we got to do, we got to tell the computer where the patient's skull is in relationship to the images already stored. And then once he's finished, then we'll use the balloons are guided by the CT system. It makes the operation a lot quicker. It makes it a lot easier. We can do these procedures in about 4 minutes with very extreme accuracy. There he's checking right there on her nose, on the dorsum of her nose, and he's good to go. So we're gonna start right now. I tell all my patients, if anything hurts, just to tell me, but they will feel pressure. So you can see that the X in the lower left-hand screen is entering the sinus balloon. And to right there, he just dilated the sinus. So here I'm going back in and find the sinus on the patient's right side. And right there you see the little track I'm following. I'm in the sinus balloon. You can see how close I am to the brain, the optic nerve, and the pituitary gland. This navigation makes it to where this operation is very quick. Now I'm gonna go in the sinus below her left eye, which you can see. Again, as you notice, balloon, I'm not even using a camera to look in. All I use is navigation. This patient's case is kind of tricky because she's got a lot of sinus infection, and that tissue is not good for taking up the numbing medicine. It's important the patients, they not wrinkle their forehead or anything that throws the marker. Now I'm using the scope just to make sure I'm on what's called the lateral aspect of the middle turbinate. Then once I get in, all I'm using is navigation. You can see I'm heading up to that black sinus. You see the tip of the balloons where the X is. It's way up in the sinus, really. All right, that's it. Make the right choice, come see me.